Okay, everybody, welcome. Ralph Havens here, physical therapist at Beyond Limits Physical Therapy in Bellingham, Washington. And I'm with Dr. Tom G. Mateo on our podcast, When Doctors Have No Answers, even though Dr. Tom G. Mateo is a doctor, chiropractor, naturopath, and co-developer of integrative manual therapy, the technique, the process that we use to help find root causes of pain and conditions and help people get their health and their life back. And today I want to talk to Dr. Tom about runners, distance runners, and especially elite distance runners, and low iron and anemia, and any implications for people that are regular runners or exercises, and the idea of fatigue and blood and an IMT perspective. So thank you for being on, Dr. Tom. I know you're fitting us in today. So good to see you.
Ralph, how are you?
I'm good. I'm good. Yeah, I was curious, we talk about IMT being a structural medicine, a structural manual therapy piece that can help with restored function, but also set the body up so that it can do better things with the physiology, like that can help with conditions. We would think of anemia as a thing that, well, you got to give them iron or something, but there's other ideas around this. Can you just tell us what you think? I know you've worked with elite athletes at all levels, and what do you think about this?
I just wanted to do a quick summary that what does IMT contribute to the running world? I have a number of clients over the years. In 1996, I was a physician at the 96 Olympics in Atlanta, but I still have about 20 clients that are high performance people. So especially runners, because of the terrain that they train in, the instability that over time they get dings in their alignment. So IMT offers different tools like biomechanics and strain counter strain to reset those muscles. And most of my runners come in 2 or 3 days before they're going to do a huge race and get reset so that their muscles are performing great, their biomechanics are moving just better. One little case study was somebody came in and first time meeting me, and we did the biomechanics of the pelvis and the lower extremities, and she improved her time by 20 minutes. So we have a bunch of professional athletes that come in and get reset of all their structure before they start, and their performance level jumps up another level. And you had just brought to me this case where they found anemia in the system, and anemia takes a number of different formats in the structure of Western medicine. Anemia is lack of oxygen and lack of iron carried by the red blood cells. And we all have suffered from 2000 to 2004, the COVID series, and that was one of the things that was interfering with the original COVID virus, that people were losing their oxygen, and we were all testing with oxygen oximeters to make sure that we had a good percentage of oxygen in our system. And now it's called long haul COVID. And before that, it was called mitochondrial distress. So there are many ways to bring oxygen to the system. And the topic for today, which we want to work on, is anemia, which means there's possibly less iron in the system, but you can have anemia from other different, like there's not enough red blood cells or there's not enough chemistry. But some people just don't have enough iron in their diet along the way, right? So we can adjust some cofactors for that. And I can give some nutrition tips that I would suggest that we have in our armament that really help, especially. And when I give a protocol for our marathon runners, we have support for the adrenals, we have support for the mitochondria, and every 2 miles of running, my clients actually try to pop a supplement pill so that they're keeping their energy up and keeping their stores up so they can provide that ability. And then I have also a protocol that we use for high altitude sports or hiking or going to Nepal or going to Machu Picchu too. So, Ralph, where would you like to go first?
So the standard thing that I see is they try to give a lot of runners, especially the ones training at altitude, look at the ferritin and the hemoglobin levels and all that, to iron levels, to see what they know that they might have an anemia problem that they kind of look out for, and their solution is to give iron. what do you see from the structural piece or the integrated manual therapy piece or anything else that you see that could help distance runners, especially the ones that are training at a high level and lots of miles and altitude, and they talk about, all the foot strike, maybe does that really tear up blood cells, and is that a problem? What would you look at? Like, what would be the differential diagnosis kind of thing of, okay, let's make sure these pieces are in place. If you see somebody coming in with, fatigue and they're starting to get some blood tests that are saying some sort of anemia, whether it's low iron or something else, what kind of the things you look at?
Well, a good source of iron is dark green leafy vegetables. The more bitter, the more absorbable that is. A lot of the iron supplements out there are too harsh, and you'll get just as much iron by chewing on a nail that you would if you took the iron supplements. And a lot of people complain about constipation.
They
So,
talk about that they don't do it every day because of that kind of issue.
right. So the best source is dark green leafy vegetables, number one, and red meat, number two. And you want to find an organic grass source of that at the same time. But you also need a lot of cofactors. You need calcium, you need zinc in that process. Um, and we have a simple, it's called zinc tally, which is a liquid zinc. And um, if you put the zinc tally in your mouth and it looks like water and tastes like water, it's an indication that you don't have enough zinc. When you actually have enough zinc in your body, it really gets bitter and sour in your mouth. So we use
Isn't
that,
that interesting?
right? So one step to get iron in is you need the zinc and you need the calcium to make hydrochloric acid so you can process that, right? Another thing that's been becoming popular is beet enzymes. Heman is one good source, but I tell people get a cup of beets and eat a cup of beets a day, right? And that will produce bile. It will help the absorption of iron because it breaks it down into your food. Okay. The anemia can happen because one, we may not be getting enough. Two is the red blood cells aren't being produced enough, or the red blood cells are sick and don't know how to absorb the iron in that whole process. So, traditionals, oh, let's give them an iron supplement, and then they get constipated. Well, that's an indication that their whole system is a little bit off at the same time, right?
That's neat. I used to do beets every day for breakfast, and I'll have to get back on that. We
Yeah.
do beet fermented beet juice now, beet kvass. And
Yep.
Ben is wanting to, he's drinking that now because he knows it improves the oxygen for the blood. So
Yep.
so that's neat. So green leafy vegetables, some beets or even beet juice. We do the fermented one. That's interesting about the zinc tally. I'll leave a link to that supplement in
Hmm.
the places this is at. And then GI regen is the thing that you were talking about, the thing that they take to help the gut.
Yep. So
Interesting.
our first supplement would be um, GI Regen because it really helps balance off the GI system and also helps balance off the stress system so that we're moving along. So, most of my prescriptions when for nutrition when they first walk in the office is get off of gluten, get off of white sugar, get off of peanuts and almonds, and then add a half a cup of beets a day into your diet. We have an amazing green tea that can't be found out of Asia. It's a white oolong green tea, which helps the oxygen to break down food again. So those are usually the first layers, and people start to feel better because they're not polluting themselves most of the time.
Yeah. And you actually did your research on one of the ingredients in that GI regen, the tribulus, which is an
Yeah,
interesting thing. You could look that up and see all the things that are tribulus is good for. We use it for food poisoning too. You taught me that one,
yeah.
cranberry that's in there. And anything related to bone health or the big things that I see the distance runners, especially at the elite level, and even the middle school, high school, college kids, if they train too hard, or sometimes they're not training too hard, it doesn't seem like it. They're training somewhat looks correctly, but they get these thing they call stress reactions or bone bruises or and then they're out for 6 weeks or more. Does that fit in with any of this, or what do you?
Well, again, we have a wonderful calcium lactate, and there's many forms of different types of calciums, and the calcium has to be attached to another metal. So there's calcium lactate, there's citrate, there's magnate, and a whole bunch of different things. But we really found that in my practice, the calcium lactate seems to be the most absorbable and the most useful for the bones to have bone resorption there. It's kind of hard to find the calcium lactate, and lactate isn't about milk, it's about the lactic, it's attached to lactic acid. And the digestive system of that only takes one enzyme instead of 5 enzymes to be a useful calcium for the bones, for the repeat structure of those pieces.
And I'll put all these links in the descriptions wherever you find us. And is there any I work on athletes, and especially before races, we work on Ben a lot, and his stride is just beautiful. It's just beautiful. And restoring the biomechanics, he taught me the helix biomechanics techniques. And anything else about the manual therapy approach to this, to optimize the way the body works so bones can function?
To go back, the GI regen supports the adrenals, right? And so if we look at the dynamic of the foot and we look at what it's supposed to be doing, functioning from walking to running, okay, the posterior tibialis muscle, which in Chinese medicine is hooked up with the kidney meridian, and the kidney meridian relates with stress. So if we actually have depleted kidney energies in our body, our posterior tibialis will be weakened and our arches fall. So if we have a fallen arch, which also is induced by extra exercise, it in my world, in your world, it's all about the adrenals holding up the arch of the foot. So if we
Which
don't
is
have
so unusual. Nobody talks about that. Something as far up as the adrenals can be affecting the way the foot raises up.
Right, and the orthotic systems we use from Soul Support are amazing to return that stability to the process. But again, if you have a dysfunctional foot, and in my teaching and in the demonstration of why we need orthotics, I have somebody just walk across the room and we have an impression foam, and they step into the foam and just watch how their foot naturally goes through this stepping the gait cycle. And then we then go and capture the foot with a high arch and give them adrenal support. And you can actually see the arch keep rising and rising during that time. And it's so narrow and so powerful that way. And when you're in an unstructured foot, it all wastes out to the side. So a lot of the stress induction is that we lose about probably 40–50% of our shock absorption that would be there because of the posterior tibialis would create the arch to bounce instead. So we're slapping it's almost like if you were to slap your hand on a drum or a table 100 times, why wouldn't your bones get bruised? Why wouldn't your arteries get bruised?
Yeah, and if the GI tract is locked down or not doing well, that whole pelvis hits the ground harder too. So and what about vitamin C? The adrenals are connected to vitamin C too, right? Like they.
Yeah. So well, the adrenals and the kidneys help produce vitamin C. What we use in our nutritional line, Ralph, is mostly whole food products. We don't specifically chase. And there's a whole philosophy. Do you use whole food medicine or do you use individual processes? So when you're using a manufactured vitamin C, it actually depletes the body over time faster. It may help with a cold, but you're actually, because you got so much vitamin C and you're trying to have a reaction, somebody else has to be stolen from to keep up with all the other things that it's involved with. So yes, vitamin C is sort of important, but we have to find the natural source of vitamin C.
Natural sources. Oh, that's good. Yeah. Well, this has been really, really useful. I wanted to talk about this piece because distance runners, especially those training at a high level, the bones can be an issue, the stress fractures, and then sometimes you see this anemia thing, And so those will be some, I'll put all the information where we see this about the diet, that elimination diet that we recommend, and the GI regen and calcium lactate and the zinc tally. And I'll even go find our beet kvass recipe. It's really simple to make a fermented beet juice. And
Right. And it could be any form. It could be cooked, it could be raw, it could be juice.
yeah, you could just
Those,
make, yeah,
those
yeah.
antioxidants and the nitric oxide that it produces has been written up a number of times to elevate oxygen levels and to help to bring the anemia down. So if you have lack of iron, the question is, why aren't you absorbing it and what's it going towards in those pieces at the same time, right?
Yeah.
And we also go in deeper when we're helping detoxifications. We're actually helping the bone marrow, which produces the red blood cells. We found inflammation of that since uh, the post-COVID era. Um, you know, could it be the chronic long haul COVIDs, or it could be a vaccination injury? Who knows? But it still shows up the same thing. They were there before, but they weren't as prevalent. So since that era, a lot of people are coming up with more hypersensitivities and things in the world.
Yeah, and the nice thing, not nice, the most amazing thing about IMT, I find, is the myofascial mapping, because you can find what's the actually cause for in your body of what's going on, and then figure out.
It's the flagship of how we
It really
determine
is.
to go on. So we can see if it is an adrenal problem. We can see if it's a stomach problem. We can see if it's a neck compression of the vagus nerve. Are you always in sympathetic overdrive? Are you always in hyperstimulation? And could be structural, or it could be emotional, or it could be actually a food source. So
Yeah,
those tools really help us.
you want to find the right,
Right.
um, the right place to look and see what is it you're actually dealing with and help. I had somebody that had a concussion a few months ago and helped her out, and she was doing fine, but and I won't give too many specific details, but she had all sorts of dizziness showing up again, and she was assured, because she had done some of her research, and she thought I needed to do that Epley maneuver. She thought it was like her ear, but when we did the tests and did the mapping, we found it was a little issue with a little artery, a little vertebral artery. And we
Right.
did the techniques that from integrative manual therapy, from cardiac 2, and and in Sharon's words, your words, and from the day back in the day, we fixed it up, and her neck was really good, and her didn't have that vertigo thing. So it's all about finding what your body needs. So reach out to us. Dr. Tom is at imtwellnesscenter.com, and he's in West Hartford, Connecticut, but also available over phone call or Zoom for consultations, 860-561-2286. And I'm in Bellingham, Washington, ralphhavens.com. And if you're dealing with something that hasn't been helped, reach out to us and we can help find what's the cause of your thing. I'll put the links below. And Dr. Tom and I do this podcast a couple of times a month. And let's get out there and get back on the trails and running and do what you're here to do. Any parting words, Dr. Tom?
Cheers to the beet juice.
Cheers to the beet juice. I'm on it. Mine is fermenting right now, actually, and it's about ready. And I'm actually going to start to redo. I used to do it every day, every morning for breakfast. And I know our little runner, Ben, is going to want to do that. So, all right. Well, good to see you. I know you get back to work, and you're actually still working now as we speak. And I'll see you very, very soon. Thanks for this extra session.
Okay, Ralph, have a great day.
Have a really good one. Bye.